Hi, Miss Virginia. I'm Dr. Burpee Conroe. How can I help you today?
Yeah, me and my fiance are getting married soon, and we're super excited.
Congratulations.
Thank you. But we're not ready to have kids yet, so I was
Yeah.
just coming to learn more about birth control today.
Are you looking, what kind of options are you looking for? A more natural option or things such as a pill?
Yeah, some of my friends take the pill and stuff, but I was wondering what some of the more natural options could be.
Yeah. Well, the best option for anything natural is to just track your ovulation.
Oh, okay.
Ovulation is when our body drops the egg, which to wait to be fertilized. And so if we know when that's going to happen, usually we can avoid sex either 5 to 6 days before or 1 day after, which is the time period of fertilization.
Okay.
And so if we avoid having intercourse around those times, then you won't most likely not to have a baby.
Okay, so I just kind of track it with like a calendar, kind of?
Yeah, you can use a calendar, and then they have things such as ovulation test strips.
Okay.
Where you just throw a little pee on there, and it will tell you when you're ovulating exactly.
Oh, okay, that makes a lot of
so,
sense.
Once you do this once or twice, you'll know your exact ovulation for the most part and be able to prevent pregnancy.
Usually I like surprises like, oh, when's my period going to be? But I guess
Yeah.
that makes sense. That's super cool.
Yeah.
I've also heard about condoms and stuff. What's the exact science behind how condoms work?
Yeah, so condoms are a physical barrier which prevent the sperm from getting into the uterus and going up there to fertilize the egg. And so usually it just does that. We have different like male or female types of condoms, and this can also help with preventing STIs, STDs.
Oh.
And then it's usually about a 90 to 98% accuracy for preventing pregnancy.
Okay, gotcha.
Usually, the only time you would get pregnant in something like that is if something like lube has disrupted the condoms and
they were the Converse or something like that.
Yeah, or it wasn't put on properly.
Okay, that makes sense. Well, I think those are just the two natural ones I had questions about.
Okay. And then do you just want to talk about the pill a little bit to learn a bit more about it?
Yeah, I mean, I'm here.
Okay.
I wouldn't mind hearing.
So the pill, the way it works is it will increase our different levels of estrogen and progesterone, which is the best type. There are many different types, but the combination one is the best.
Okay.
So with the increase of estrogen and progesterone, we decrease our body's likelihood to ovulate. This by decreasing something called an LH surge, which is what causes ovulation. And then it also thickens the cervical mucus, which makes it very hostile towards the sperm, and so it makes it less likely for them to be able to get up to the egg.
Okay, so basically the increased estrogen and progesterone tells the body, hey, don't release the egg, and then it kind of makes almost like a condom inside by thickening the cervix, the mucus?
Yeah, exactly.
That's super cool. Awesome.
But like with anything, there are some pros and cons, just to let you know. Some common side effects is you will have maybe increased bleeding just for the first little bit before your body gets used to it.
Okay.
And then breast tenderness, headaches, acne, weight gain, depression are some of the most common ones.
Okay.
Some higher increased ones may be ovarian cysts, blood clots. You do have an increased likelihood of getting breast or cervical cancer.
Ooh, okay.
But it's just weighing the pros and cons, you know?
Yeah, for
Just like
sure. Thank you for helping me find the pros and cons. I think I'll take some time to think about it, but this has definitely helped me a lot.